Welcome back to Dr. Sellers Educate. We're happy that you're back and thrilled to continue to support you on your journey towards success. If you haven't already, go ahead and subscribe to this channel so you can be alerted every single time there's a new episode. If you haven't been to our website, make sure you go there. It is drsellerseducate.com to find out about services and programs that are available to help you on your journey. Our mission is simple here at Dr. Sellers Educate. It is to support every nurse educator to achieve a certification by the NLN as a nurse educator. That journey can be challenging for many, and we want to support you on your journey. For this specific snapshot, we're focusing on clinical judgment models, 3 key teaching strategies that you want to be familiar with as you continue on your journey. The definition that was published back in 2019 by the NCSBN as it relates to clinical judgment definition is that it is defined as the observed outcome of critical thinking and decision-making. It is an iterative process where our nursing students are using their nursing knowledge as they observe and assess presenting situations to identify the prioritization of care. We also look at the evidence-based solutions and interventions we use to deliver the best and safest patient care as we think about the decisions we're making for our patients every single day. 𝐍𝐿 and 𝐍𝐮𝐫𝐬𝐞 in 2017 released a statement based on their findings that 23% of new nursing graduates are safely able to recognize urgent changes in the patient's condition and to identify appropriate responses to manage those critical changes in those conditions. Now, if you're like me, you were probably surprised by 23%. That's only roughly 2 out of 10 nurses can make these decisions and recognize these changes. This is concerning and really does prompt us to a call to action as a nurse educator. So what can we do? Well, I'm glad you asked. There are 3 key teaching strategies that we want to focus on to help close that gap and to better equip our nursing students with the knowledge that they need. First, we want to incorporate these teaching strategies, these learning activities that are going to help our students develop these abilities to apply clinical judgment, right? We want them to recognize those sudden changes. We want them to know what to do and the why behind it. That's how we ensure that our students are able to engage in those safe patient care practices. Second, we want to better understand the learning styles of our students. Now, we're going to know each individual learning preference or learning style? No. But what we want to do is incorporate a variety of those teaching strategies and activities so we can better measure and better support students' learning as they scaffold the knowledge that they know and figure out how to apply it in the clinical space. That's what clinical judgment is all about, the ability of students to transfer those knowledge and those skills into an ability at the bedside with our patients. Let's go ahead and take a look at a practice question. So we have several of our students that are struggling with the care of the CHF patient. So what strategy would we use to best facilitate their learning needs? We have 1-minute paper, algorithms, unfolding case studies, and flashcards, all as examples. If we wanted to choose the best option, it would be those unfolding case studies. As we talk about the integration, as mentioned by Dr. Patricia Benner at ATI just a couple of weeks ago, she focused on what she called the paradigm shifts in nursing education, where we move from this radical separation between our classroom learning and our clinical learning. We integrate those two. What does that mean? We talk about theory. We teach how to use theory in the clinical setting. It's about knowing how we should practice as well as when those action steps should be taken to provide the safest patient care possible. We want to focus on what she calls deep learning, understanding that less is more. There's so much to learn in nursing school. We've all been there. So we want to ensure that we are providing a framework, a solid foundation for our students to build on, to scaffold their learning so that they can clearly understand some of those key assessment components that they want to use when they assess that heart failure patient, and they know what to do when there's been a sudden change. Those are the action steps that we need to take in order to develop the clinical judgment skills that we need for our nursing students to have when they graduate or shortly thereafter. ATI has published a wonderful clinical judgment guide that really is shaped and developed to assist us as nurse educators on how to develop and implement some of these clinical judgment skills, right? That's what this is all about. How can we as nurse educators have a stronger impact on the development of our students' clinical judgment and their assessment skills to save patient lives every day? All right, so this has been Dr. Sellers Educate. I'm so happy that you spent your time with us, and we look forward to hearing from you. Until next time, have a great one, everybody.